Welcome to America's Wellness Experts. I'm your host, Gina Poole. On today's program, we're going to be discussing 3 big myths about hormonal problems that are keeping your health hostage. My guest expert is Dr. Deborah Matthew. Dr. Deborah Matthew, MD, is the founder and medical director of Signature Wellness. 12 years after graduating from medical school, she decided that she wanted to offer more value to her patients. She knew that emerging science showed that there was more to offer in the areas of preventative medicine and wellness. Dr. Matthew combined her background in traditional medicine with her interest in fitness and health and nutrition to create a complete medical wellness center. Her vision was to be able to offer advanced wellness care utilizing scientifically based medical concepts free from pharmaceutical industry biases. This is in response to the observation that despite advances in medicine, preventable illness makes up 70% of the United States health burden. Dr. Deborah Matthews, thank you for being here today.
Thank you for having me.
I'm very excited about what you're going to be teaching us. We're going to be talking about 3 big myths about hormone problems, and I know that they're big myths, and you're going to share with us what the truth is. So let's dive right in and get started. You told me myth number 1 about hormone problems is when you go through menopause, it's natural, and you don't need hormone replacement. So if that's a myth, what's the truth?
Sure. So when a woman goes through menopause and her hormone levels naturally decline, the next 5 to 10 years are a time in her life where the aging process speeds up rapidly. There's a lot of inflammation, and there's actually rapid decline in her health status. Now, everyone is very unique, so for some women this is a bigger problem than for others. So every single woman in America doesn't necessarily need hormone replacement, but if you think about what happens with age as our hormones decline, we get changes in our skin, our muscle mass naturally declines, we lose bone density, we have changes in the vaginal tissues, even our pelvic floor muscles can change, and so that we can be more likely to lose urine. If you think about a frail, elderly little old lady who's very thin and has a lot of difficulty even having the strength to stand up out of a chair, that's someone who is very hormonally deficient. But that starts right around the time of menopause. So the diseases of aging that we don't want, things like heart disease and dementia and osteoporosis, hip fractures, incontinence, even wrinkles, these things are associated with hormonal deficiencies. There was a really interesting study where an observer sat in the waiting room of a gynecology office. And when a woman walked in the door, they just rated how old they thought that woman looked. They took a guess and wrote it down. And then she went in and had her estrogen level measured. And what they found is the women who had the lowest estrogen levels looked on average 8 years older than the women who had the highest estrogen levels. So estrogen even affects how we look. And hormones also play a really important role in sexual function. So as hormone levels decline and our tissues change, women can lose interest in sex, but it can also become painful, and that can really affect marriages. So hormones are important. They play a big role in who we are on the inside, how we feel. They affect our mood, our energy, our quality of sleep. So they're really very important. One analogy that we would give is it is natural with age for our eyesight to change, but you would never tell someone that they don't need reading glasses because their vision change is natural. We would just say, your vision has changed because of your age, and here's what we can do about it. So hormones are important, but it's important to understand that they have a preventive role. So when a woman goes through menopause, that first 5 to 10 years is a really important time to have this discussion about hormones. If someone comes in when they're older, if someone comes in when they're 70 and they've already got some heart disease and osteoporosis and incontinence, they're already having some of the diseases and changes that happen with aging, starting the hormones at that point doesn't go back and erase what's already happened over the preceding couple of decades. It can help in some cases for certain things, but it's much better to have the conversation right around the time of menopause, and that's when we can really do the best job at helping women feel their best and maintain their health for the future. Because now we have a pretty good life expectancy. We can expect to live 10, 20, even 30 years or longer after menopause, and it's important we want to be able to maintain our vision, our mobility, our memory so that we can live independently and have vibrant lives into our old age.
That's fantastic information, Dr. Matthew. That makes a lot of sense. It really is important. Hormones are important, and certainly women going through menopause that still have symptoms and issues. I think you've explained it beautifully.
Well, thank you. I do find that it is a discussion that needs to be had, and women need to have information in order to be able to make the right decision for them.
Absolutely. Well said. What about myth number 2? And this is a myth that I know everyone listening has heard. It is prevalent. You have told me that myth number 2 is hormones are dangerous and can cause cancer. If that is a myth, what is the truth about that one?
So this is a really big one, and I spend a lot of time talking to women about this one. When I was in medical school in the early 90s, what I was taught is that all women should go on hormone replacement therapy for their own good because it was going to help to prevent heart disease and dementia and osteoporosis. And we had sort of a one-size-fits-all approach. We gave everybody the same pill, and a lot of times women had side effects from this. They didn't want to take it, and they went off it, and we were really upset. We had a paternalistic approach that we wanted everyone to take this pill for their own good. Everything changed in the early 2000s because a study came out that showed that women on hormone replacement therapy were having an increase in the risk for breast cancer. And the purpose of the study in the first place was to try to prove that the hormone pill was reducing the risk for heart disease. But instead, what was happening in this study is that women were having slightly more heart disease. And this news hit the media so that everybody has heard that hormones cause breast cancer and hormones can cause a heart attack. There were a lot of problems with the study, though. One of the problems is that the women in the study were already older when we started them on hormone replacement therapy. So we've just finished saying works better if we start when they're younger. But this study was largely made up of women who were already older before we ever started the hormone replacement. Another problem is the hormones that we used were not the natural hormones that are in a woman's body. We call those bioidentical, meaning they're identical to a woman's hormones. But that's not what was in the pill that we had been giving out. That was our standard pill that we gave, and we didn't really know that there was a difference. The doctors who were prescribing it generally didn't understand what it meant to be bioidentical. When we give this particular pill, it increased the risk for blood clots. And, of course, a blood clot in your heart would be a heart attack. A blood clot in your brain would be a stroke. And this particular problem was more of an issue for older women, and, of course, those were the women in the study. What we know today, now we've had over 15 years to look back and understand more, is that if we use the natural form of the hormone, and if we give it by a different route instead of as a pill, and we've got lots of choices, we've got creams, we've got patches, we've got pellets, if we use the natural form by different routes, we don't get the same risk. One of the biggest problems is in the pill that we gave. Instead of using progesterone, which is the natural hormone that our ovaries make before menopause, we used a drug that was called medroxyprogesterone acetate. And this is a drug that tries to copy progesterone, but it's not the same thing. And it was this drug that was increasing the risk for breast cancer. So in that study, there were 2 different parts. One part was women who'd had a hysterectomy, and one part was women who still had their uterus. So the women with the uterus got the pill that had this progestin drug in it, and the purpose of the drug was to help protect their uterine lining because estrogen can cause the uterine lining to thicken and bleed and even could cause an increase in endometrial cancer, uterine cancer. And so this progestin pill helped to prevent that. But in those women, it increased the risk for breast cancer. Now, the other part of the study were women who had to have a hysterectomy for whatever reason before the study started. they were only given a pill that had just estrogen in it. It didn't have that drug. In that arm of the study, the women did not have an increased risk for breast cancer. Even when we divided up by different ages, the fact that some of the women were older in the study didn't make a difference. At no age group did the women have an increase in the risk for breast cancer. So since that time, we've had lots of new studies come out. And what we've learned is that if we give a woman natural progesterone instead of the drug, that it can protect the uterine lining, but it does not increase the risk for breast cancer. And we have studies that have come from all different parts of the world. Some of them have been fairly large and have followed women over a good period of time. So we understand what we did wrong in that study, and now we understand how we can do it differently in order to get better results. Overcoming that fear is very difficult because we as women fear breast cancer, and so anything that could possibly increase our risk for breast cancer, of course, is very concerning. But, even in that original study where they used the synthetic pills, even with the synthetic pills, if we just statistically crunch the numbers, women were still better off on the hormone replacement therapy than they were not. Because on those pills, there was still a decrease in the risk for osteoporosis. We had a decrease in the risk for colon cancer. So overall, women were less likely to die if they took the hormone replacement than if they were on no hormone replacement at all. And since the study, hundreds of thousands of women have gone off their hormone replacement because of fear, because their doctors recommended it. And studies have been done that have estimated that perhaps as many as 90,000 women have died because they stopped their hormone replacement therapy. So at this point in time, with the medical research that's available to us now, with our knowledge now, with all the different options that we have, many of those options weren't available to us before. Now the benefits of hormone replacement therapy outweigh the risks for the vast majority of women. So all of us are unique. We all have our own personal health histories and family histories and risk factors. So it's important to have a comprehensive discussion and know about all of the different factors that are involved. But women shouldn't fear hormone replacement therapy and shouldn't suffer with symptoms because of the fear. Because there's so much that we can do to help women feel better, have better quality of life, and fear of hormones is so unfortunate that women suffer because of that.
Dr. Matthew, I have interviewed a lot of experts on this program, and I can tell you we have not had someone explain the truth about that myth as comprehensively before. So thank you very much. I think this is such important information, and that myth really scares a lot of women, scares a lot of men, for hormone things, because obviously there's the myth that it can harm men, it can cause disease for men as well. So this is so important, and thank you for really debunking that myth.
I really feel bad that so many women suffer because of this myth. This myth has really harmed a lot of women.
Yes, it has. Very, very true. In the time we have left, let's be sure that we get through all of our myths and what we're discussing today. So let's go ahead and move on to myth number 3. And that myth, you told me, is if you're not, quote, older, end quote, or in menopause, then you don't have a hormone problem. So why is that a myth? And certainly tell us the truth.
A lot of people think about hormones in terms of menopause. But you can have a hormone problem from puberty and on. And I talk to a lot of women who feel like something's wrong. They know that something's wrong. They're having symptoms, and they go to their gynecologist or their family doctor and ask, could I be in perimenopause? And their doctors tell them, no, this is normal, and sort of dismiss their concerns. So perimenopause is just a word that means the years leading up to menopause. And the average age of menopause is 52, but the changes can start many years ahead of time. So it's not uncommon for me to see women who are in their mid-30s who are already starting to show some hormone changes that we would call perimenopause.
So you can be much younger and still have these problems.
Absolutely. Now, we even see younger women than that. We can even see women in their teens and 20s who have hormone problems. In that case, it's not perimenopause, and in those much younger women, it's more important for us to understand what is the root cause of the hormone imbalance and address the root cause but that's not what's done. What's done is birth control pills are offered to try to regulate their periods. And even for the women who are starting to head into perimenopause, that's the treatment. If you come in and you're complaining of symptoms, the answer that we have to offer you in conventional medicine is birth control pills. But the kinds of symptoms that are common are things like heavier periods, shorter cycles where the period is starting to come more often, even maybe every 3 weeks instead of 4 weeks. We have women having more PMS, breast tenderness, fluid retention, bloating. Sometimes the symptoms are more severe, and sometimes the problem is that the PMS lasts for more days, even a whole week, sometimes even longer before their period starts. It's common for women to start to feel more anxious, especially before their period, and irritability and mood swings are common, especially before their period. Sleep is often interrupted, where they're not sleeping soundly through the night. Often women can even start to develop some night sweats at night, and this is also more typical leading into their period. And these symptoms can be really significant. So it can affect marriages, it can affect families, it can affect your work performance, and I have personal experience with this. I can tell you that there was a time when I wasn't always so nice. I was anxious and irritable. I was short with my kids. I wasn't always so nice to my husband. And since I've been hormonally balanced, I feel so much more like myself, and I'm a much nicer person. But if women go in complaining about these kinds of symptoms to their doctors, typically they're either offered birth control pills, sleeping pills, antidepressants, or anti-anxiety pills. And sometimes those things do help somewhat, but it's not really restoring their wellness. It's not really getting to the root of the problem. And often one of the solutions that women are offered is a hysterectomy, especially if the heavy bleeding is a problem. And while sometimes, hysterectomies are necessary, sometimes hysterectomies could be avoided if the hormones were balanced. So the message here is anyone can have a hormone problem. You don't have to wait until you're in menopause in order to solve the problem. And there's a lot that we can do to improve quality of life at any age.
Dr. Matthew, that's great information. I know that you have a very unique practice. You have very unique training. You're trained in traditional medicine as well as integrative and functional medicine. It really makes your practice very unique and different. Can you tell us a little bit about what makes you unique and why that makes you unique to help these hormone problems?
When a woman presents and she's got symptoms that we think are hormone problems, what we want to do is we really want to identify her unique physiology. So we want to know the picture of the hormones, what's going on, by doing some lab tests. But we don't just want to correct the problem by writing a prescription. So if all that we're doing is using natural hormones or bioidentical hormones instead of using, birth control pills or synthetic menopausal hormone replacement, that's not really enough to really restore a woman to wellness. What we need to do is we need to look at her in a holistic way. We need to think about the underlying factors that have created the hormonal problems and really address those too. So by looking at things in a holistic manner, considering her lifestyle habits, her stress levels, the other medical problems that may be contributing to her symptoms and her hormonal issues, we are able to get much better results. We're much better able to diminish the potential lifestyle or the potential health risks, both of hormone replacement or of avoiding hormone replacement, and really help to restore wellness and quality of life and make people feel so much better.
Dr. Matthew, if someone listening sees themselves in what you've been talking about, they really are having symptoms and issues and unresolved symptoms and issues, and they want to explore potentially become a patient with your practice, what's the next step for them to take?
Sure. So the next step would simply be to call the office and schedule a consultation with one of our patient care coordinators over the phone. And what they will do is learn a little bit more about the caller and what their health concerns are in order to identify whether we're going to be the right place to help them with their issues. And they can answer their questions about how the practice works and what we have to offer for them. And if it seems like it's a good fit, then they can get them scheduled for an appointment and we can get started.
Wonderful. Dr. Deborah Matthews, thank you so much for being here. Fantastic information.
Well, I've really enjoyed talking to you, and I certainly hope that this information can help women when they're making their decisions.
Everyone listening, thank you for your time. We sincerely appreciate it. Take the next step. Contact Dr. Deborah Matthew at the number and website that you see on your screen. Take that next step and explore if it's a fit for becoming a patient in her practice and get those solutions to unresolved hormone problems. This has been your host, Gina Poole. Thank you for joining us, and we wish you health and success.